I don't know. I don't know if your ACL is torn, and nobody does, not without an exam and an MRI. But you're dealing with these three things, then you need to come see me. Stay right here. Next play starts now. I'm Ty Taubenheim, orthopedic nurse practitioner and former Major League Baseball player. You know, I've evaluated hundreds of sports knee injuries, and by the end of this video, you're gonna know exactly what those three signs are, what they mean, and what you need to do right now. Let's go. Here's the thing. That pop you heard, the buckle, the moment where everything stopped, the fear you're feeling right now is completely valid. It's really normal. But fear without information doesn't help you. So let's get you informed. You know, the ACL and an injury to the ACL is probably one of the most talked about things in all of sports, but do you actually know what it does? Let's just spend a minute. Let's break this down, okay? The anterior cruciate ligament, or the ACL, sits right in the middle of your knee. It connects your femur, or your big thigh bone, down to your tibia, which is your shin bone, and it has some pretty important jobs. Okay, we know what it is and we know where it is, but what does it do? It actually has two really big jobs. One of them is it prevents that shin bone from moving forward, translating forward, which can decrease stability. And number two, it helps control rotational forces of the knee. Big picture is the ACL provides overall stability, especially during rotational and dynamic activities. Think pivoting, cutting, jumping, twisting. Every explosive athletic movement you make, your ACLs work. Okay, now let's get you to what you actually came here for. The three big things. Big issue number one is the pop. Not a creak, not a click, not a tearing sensation, a distinct loud pop that sometimes people who are near you can actually hear. By itself, this doesn't necessarily say that you tore your ACL, but it is the starting gun. And it means we need to move on to issue number two. Big issue number two is rapid swelling. Cannot emphasize that enough. Rapid swelling is much different than next day soreness. I'm talking about swelling within the first hour or two. Hemarthrosis, where that joint swells with blood and kind of feels like a balloon. You have a pop, you have rapid swelling, we need to move on to big issue number three, and that's instability. That feeling that you're just not doing what you're supposed to with regards to that knee. It's not moving like it should. Athletes kind of describe this as feeling loose or buckling or giving out with certain movements. That's the ACL telling you that it stopped doing its job. That's not soreness, that's structural instability, and it lets me know that something significant happened in that joint. So we got a pop, we got rapid swelling, and we have joint instability. You need to be seen, and you need to be seen today. In truth, you cannot confirm an ACL tear without two very important things. Number one's an exam from an orthopedic specialist, and number two is an MRI. That is the standard of care. Get in front of an orthopedic provider. Now, hang on. Before I let you go, there's three big myths that we need to clear up right now. Myth number one is, well, I can walk on it, so, you know, it's not my ACL. Not true at all. People can normally walk on torn ACLs. Little secret, there's actually people who've played in the NBA without ACLs. Myth number two is that if I rest, it'll get better. It won't. Your ACL gets really poor blood supply, so this really isn't an option. And number three is that all ACL tears need surgery. Look, take a big deep breath. I know how scary this moment can feel, but here's what I also know. The athletes who come back the strongest are the ones who get the information fast, they get it right, they take it seriously, and they build a plan. That's exactly what you just did. So go out and get in front of an orthopedic provider, get the imaging, get the right diagnosis, and then we build this comeback together. If this helped you tonight and you feel like I earned it, would you please hit that subscribe button and maybe share this with a less athletic friend than you so we can make sure that everybody is up to date on the latest sports medicine and how to recover from injuries, no matter your skill, your age, or your sport. And if you're local, if you're in East Tennessee, you come see me. That link's in the bio. This is Next Play Ortho, and the next play is yours.